Hi, welcome to the channel. It's good to have you here. I take it you are the person that wants to come over to the UK as a healthcare worker or as a student, as a graduate, or in any other field for that matter, since the process is pretty much the same for everyone. However, the focus of the video today is going to be mostly on healthcare workers, but stay tuned even if you are not a healthcare worker, as you may benefit from how you can use the process of coming over to the UK since it's universal. So without any further ado, let's get on to the business of the day. Why am I talking about this today? Because for the longest time, as we know, you may or may not know, the UK government has always recruited healthcare workers from outside of its borders due to a constant shortage they are facing. However, like any other country, the COVID-19 pandemic has hit hard the healthcare system of many a country. The UK is no exception. As a result, the government is finding itself in an even more precarious condition, worse than they did before the pandemic. So there is a huge shortage of healthcare workers, particularly the category of healthcare assistants, or what we normally refer to as nursing auxiliaries back in our home countries, or care assistants. So if you are a care assistant or healthcare worker or nursing auxiliary, you too can join the masses and apply for your UK visa to come over to the UK, because there is a dire shortage of this category of workers in the UK currently, particularly post-COVID. There are many other reasons that are contributing to that as well, but COVID is the lead cause. So this presents itself as a golden window of opportunity, if you ask me. Why? Because healthcare assistants are not typically on the skills shortage list. They've not always been added to that list. Will it last forever? No, it doesn't seem to be the case. According to the UK government, they are looking to recruit at least 30,000 healthcare assistants over a 12-month period. This is with effect from mid-February, as we speak, mid-February 2022. So, hence I'm saying it's a window of opportunity. It will not be here forever. Clearly, at the end of 12th week, one would think that they will review to see if this drive or this initiative has made a difference at all in the healthcare system, and whether it's plugged the holes and the gaps that needed to be filled. So waste not a minute. Get going. So if you're finding any value at all in this video, please consider subscribing to this channel and consider making it your virtual home away from home, a place where you come to for information on how to come over to the UK, advice, hacks, and I'm hoping with my experience of being in the UK for over 10 years will help you avoid some of the pitfalls that I had to fall into to learn my hard lessons. So consider subscribing. Don't forget to click the notifications bell so you can get notified when I post a video, and your support is greatly appreciated. So healthcare assistants are a vital and such an integral part of any nursing team. Without healthcare assistants, a lot can come to a grinding halt. So this should tell you, the nursing assistant, you, the care worker, you, the nursing auxiliary, just how important you are in the bigger scheme of things. So own your role with pride. Think of this opportunity as once in a lifetime and make the most of it if it is for you. If it's not for you, please share this video with someone else that can benefit from it. Click like if you're benefiting from the information. But healthcare workers, in summary, are those people who make it possible for many an institution to run. I mean, when I say institution, within the healthcare industry, within the care homes, within the children's homes, within the hospitals. So what do? What is the role of a healthcare assistant typically? This very important category of people plays such a vital role. On paper, you will be told as a healthcare assistant, you are expected to help assist with personal care needs such as bathing of the patients or the residents, feeding, toileting, ensuring safety, and things like that. In my view, I feel it's such a vital role that you cannot exactly tell where it starts and where it ends, because given the amount of time a healthcare assistant spends with their resident or their client, they play such a vital role, far more than what's on paper, especially towards the residents' mental health. In a time when there's so much isolation, their relatives cannot come in, the family cannot come in. They rely sometimes on phones. Some don't even get phone calls. So a healthcare assistant is that person that is there, that the resident relies upon for support, for help, for laughter, for conversation, to take the day, to keep the day moving. So for me, that is such a beautiful thing to witness and to see just what a vital role it is. And it's not even stated on paper, but it happens once you are there as a healthcare assistant. Your role is just so crucial. Please just understand who you are in the bigger scheme of things and walk with pride. I'm not saying be arrogant, but just stand tall in your shoes, knowing how important you are in the healthcare sector. Now, do I hear you say, I'm not a healthcare assistant and you're wanting to give up? I'm not an HCA and you want to quit? No, stay tuned. Stay tuned as I tell you how you can also benefit from this opportunity, even if you are not a healthcare assistant. So out of curiosity and trying to make your journey much easier, I've gone out of my way to make contact with some of the recruiters to establish what level of experience is required. Not all of them have come back to me, but some that have made it clear that experience is so variable according to them. There's one that has said to me, experience even in the field of taking care of, say, an elderly relative or a relative of yours that you took care of, or taking care of a child counts as experience. Some have also gone as far as saying, that same one actually, went as far as saying, if you have experience in a field of customer services, they said in retail, where you're dealing with customer services is essential. So you might find that perhaps you worked with customers in the past where you have interacted on a regular basis with people and have shown the ability to engage and interact with people. They feel that the requirements of the job can be taught to you, but otherwise you do have the necessary characteristics for who they're looking for, and you can be taught the rest of the requirements on the job. You can be provided with on-the-job training. So all I'm saying is, do not count yourself out just because you feel, oh, I'm not a healthcare assistant, or I'm not qualified healthcare or nursing auxiliary. Yes, so if you have experience in customer service, by all means, you are welcome to apply for this opportunity. And if you also have taken care of a sick relative, or it doesn't have to be a sick relative, but if you've participated in care provision of any nature, take your chances. Nobody's going to say no. There's no harm in trying. What I would also do additionally to this is to find a placement, be it an old age home or whatever place, hospital, where I can attach myself, where you would attach yourself. I'm just giving you an idea to attach yourself, because there is a requirement that you need to have at least 300 hours of experience to be considered. That's not a lot of time at all, given that most of the places operate on a 12-hour shift rotation system. So consider finding a place and volunteering. Find a place where you can volunteer and gain the necessary experience. Try to make it a win-win situation. It shouldn't just be about you gaining experience. Find a way to add value to their system, to their institution. Perhaps you could ask what are their busiest days on which you can come and help them, or what are the busiest times on which you can come and help them. And in conversation, I think it's also fair to mention that you are applying for this position and you are looking to gain experience, so that you will be able to ask them to provide you with a reference when the time comes for you to request one from them. However, all I'm saying is, do not count yourself out just because you feel you don't have the necessary experience. There are ways in which many a recruiter and employers are willing to be flexible to accommodate you. And of course, if you happen to be watching from South Africa, we have so many of these old age homes where you can just request to be attached to one and gain your experience. It doesn't have to cost you an arm and a leg. It doesn't have to be far. Just Google the nearest one to you, where you can even walk to work if cost is an issue, because you don't want to incur any further costs onto what you're trying to do. It shouldn't cost you an arm and a leg really to commute to. So find your nearest one. Whichever country you're based in, just look up your nearest old age home. Hospital is fine, but old age homes seem to be more trending, and they seem to be the ones that are looking for staff more than the NHS. The NHS is also looking. By the NHS, I mean the National Health Service, which are the government hospitals. They're also looking, but this drive particularly seems to be feeling more homes than hospitals. I'm not saying it's not filling hospitals, but the demand seems to be so much more greater on the homes. The aim, of course, being not to make this video unnecessarily long. I mentioned at the beginning about the advent of the COVID-19 pandemic that has necessitated such a shortage for healthcare assistance. Another reason that I believe is also adding to the strain in the healthcare sector is the recent participation of the UK in Brexit, where they have left the European Union. So with that being said, we have seen and still are seeing many of our European colleagues leaving the UK to go back to their home countries in their droves. Add to this the natural aging population of the very carers themselves that used to be in the UK. Some of them are still here, but they are due to retire. It's their retirement time. So again, that places a strain on the system with all of these combined factors. The pandemic, Brexit, the aging UK population of the carers has necessitated this drastic move. So I still say, where on the list is your name going to be? Are you going to be number 80? Are you going to be number 29,000? Are you going to be number 14,000? Make that call. So in the next videos, I tell you more about how you can make this possible. Now that you have the information, I'm going to tell you as to how you can apply it. So all I'm saying to you is be left out because you opted out. Not because you didn't know. It would be such a shame. I'm here to provide you with the latest information on how you can make this transition in your life. This channel is also called On the Cusp with Daphne. So step on the cusp because that's the place where inspiration meets evolution. That's the place where we step onto and leave not being the same. That's the place where we transition from one state to the other and hopefully a better state by the time we step off the cusp. That's if we ever step off at all, because on the cusp is where I plan to remain. Thank you for tuning in. In the next videos, I'm going to tell you more about the eligibility criteria. I tell you more about the eligibility criteria, what you need, what the requirements are for you to come over here. I tell you also about the benefits of being on this visa. If you've not been experienced or been exposed to something like this, it's very hard to appreciate some of the benefits. When people talk to you like this, we're thinking, well, this is foreign, it's just a visa, I'm going there to work. It's important that you know what the benefits are. So I talk about that in subsequent videos. I'm also going to tell you who the current recruiters are and give you the information as how to contact them, such as their websites and much more. So consider subscribing, share this video with someone that can benefit from it. Consider making On the Cusp with Daphne your virtual home away from home, your one-stop shop you can trust with information from the source as to how you can bring yourself over and your family to the UK. Thank you so much for tuning in. Thank you for your time. Stay tuned until the next one.